Three.
Hi, this is Dr. Nielsen. We're going to be doing trach care. So to do trach care, you're going to want to make sure you have an order that your patient has their trach. Same things I talked about in the first video about suctioning, that in case you would need to suction them while you're doing trach care, a lot of times it's a good idea to do your care and then suction your patient, because you cause friction and tickle their throat by changing that dressing, and sometimes that stimulates them to cough. Just for video sakes, we did suctioning first, but it's a good practice to do your care and then suction your patient, okay? So you'd want to make sure you have all those things from suctioning again in the room. Clean off your table, have an order, introduce yourself, make sure you got the right patient. Again, good idea to have assessed those lungs, have your oxygen source here, and it's always a good idea for trach care. If you have access to 2 people to help you, it's always the best, but you don't always have access to 2 people. Okay. Wash your hands. You got your trach cleaning kit. Get some extra gloves out on the table for you. You're gonna open your kit. Okay. We're gonna use this as an extra source here of a field. Gonna take our gloves and set them here. I'm not going to totally open them yet because we want to take the old dressing off first, okay? So clean gloves, take your old dressing off. Also, if you have a towel or one of those blue chuck pads that's got for absorbency, put that across your patient's chest to help protect their gown and just so they don't get wet and things, okay? Also, these trach colors get all gunky with phlegm and stuff too, so you can wipe it out with a 2x2 or 4x4, but if it's real gunky, we would just get a new one. And also, these really, guys, should be changed every day because of infection control purposes, okay? So, so what we have to do is, because we want to be careful not to pull out that trach, okay? So we want to take out one layer at a time, and you want to basically hold here, not real hard because you want to get that off, right? Okay. When you take your old dressing off, kind of hold it away from you, but look at what color and things it is. And you're going to put that in the garbage, okay? And looking at your site, okay? I'm going to change our gloves. Use hand sanitizer. We're going to put our new gloves on. They always have gloves that are not for fluffy hands anyway, huh? And if you know that the regular sterile gloves in these packages don't fit your hands, it's always good practice to just pick up a size 7, size 8, whatever size you wear, especially guys with bigger hands. We're gonna lay that across our patient. Okay, so we're gonna set up our kit. So we're gonna open this saline. This is the trach tie. A lot of places have the Velcro things. We'll talk about that. These are your split gauze to go around the edge of the trach. That's at the end. These are ones to help you clean it, okay? This is your hydrogen peroxide that we're gonna clean your stuff with. I'm gonna pour it in there, okay? And then there's a brush and the hydrogen peroxide. These sticks are gonna go in your saline, okay? All right. And then the saline can even get poured actually into this container as well, okay? So your sticks are gonna go in there. Okay, so the first thing we're gonna do is we're gonna use one of these gauzes and we're gonna put it in our saline and we're going to clean around the edges of the trach Okay. And under. Again, when you pick it up, it's done. Okay. Soak it. Bring it over. Bring it over. Oh, you don't want to lift it.
Let's go find out about your sure path.
Okay. Clean it. And then with the smaller ones, these ones, what's good with this is to clean that platform, okay? Clean that platform off really good. All right, because that gets all phlegmy, okay? So this piece, we're gonna pop out, okay? And it's gonna go in your hydrogen peroxide, and we're gonna let it soak. And actually, first, before you do that, that's when you could take that out first, let it soak while you're cleaning with the saline, okay? All right, so now I'm going to change my gloves again. So this time we're just gonna use clean ones. I'm sorry, it would be an extra set of sterile gloves, okay? Sterile gloves. So you have pick up this out of here, rinse it, put it in your saline, let it rinse. You're gonna take this brush and you're gonna go down into the thing and back out to get any phlegm that's stuck in there. Stick it in your saline again, let it rinse off. You really don't want to put water into your person's lungs, and so shake it off. And if you had an extra 2x2 left, let's say we did have a little piece left, you can even kind of wipe it a little bit, but remember we don't want any fibers on that either, right? So when we put that back in, guys, we're gonna go in backwards, okay, and turn it, okay, and then down in. Click it back into place. Again, if there was a disposable one, you would just change it and you wouldn't even have to clean it, okay? So then you'd have your new split gauze. This kit doesn't have one, but sometimes there's little tweezers that are available. And so we would want to put this here, up under. And that's the most challenging part, guys, is getting that gauze pulled up under there. So you'll want to practice that to get that under there, okay? These trach ties, so usually I said there's a Velcro strap. So the Velcro strap is usually green or blue and it has Velcro on the ends. So that's why two people are good. So one person would hold here and hold this plate down with a gloved hand while the other person is bringing this through to change that gown. And then you would have to sit your patient up and bring that strap all the way around and then bring it through that loop and secure it. And you'd want to make sure that you can at least get 2 fingers between there because you don't want it too tight on their neck causing problems, but you don't want it so loose that they're going to cough their trach out either. Okay, so you chart what that site looked like, that you cleaned, what you cleaned it with, how they tolerated it, and then trach care is done pretty frequently, so you can tell if someone's done it lately because there won't be a lot of phlegm on it. But sometimes patients that have a lot of phlegm producing, patients or nurses will have a little gauze or towel that they automatically just keep on that patient's chest to help prevent that patient from getting full of phlegm. Okay? Oh, and make sure to clean this out too if needed, or get a new one. Okay? That's it.